The money you were promised for retirement is being taken before you even see it. What government planners projected, what financial advisors feared, and what official documents have now quietly confirmed has finally arrived. A single update, not a prolonged debate, has reshaped the retirement landscape for countless Americans. That one document lays bare the real expense of growing older. It exposes what Medicare Part B truly extracts from your monthly income. The action taken by the Social Security Administration has now passed a milestone retirees prayed would bring comfort, and the instant that line was crossed, Medicare's machinery activated. The response was instantaneous withdrawals, compulsory fees, and inescapable decreases. Right now, we'll detail precisely how this reshapes your retirement finances. For many quarters, hints have been circulating, not public proclamations, not televised briefings, just subtle indicators that the SSA was engineering a major shift for the coming year. Their approach has been steady, absolutely, yet measured in its predictability. Their annual adjustments have traced a particular arc, a set equation, nearly a clockwork sequence. However, what alarmed money managers this cycle was that this arc unveiled a distressing fact. Specialists who track these payments recognize the signs, the yearly inflation raise declarations, the Part B premium math, the benefit protection clause reviews, the abrupt changes in medical expense forecasts. Every signal pointed toward a single conclusion. And each time older Americans witness their total benefit figure climb, it signals that Medicare is preparing to reclaim a larger share. For those who entered the workforce before the 1960s, this cycle is bitterly clear. You've labored for a lifetime. You've contributed to the fund for years. Now, just as you start to collect what you're owed, the medical system claims its portion before a single dollar hits your account. This isn't a hidden plot. This is the straightforward mechanics of the program. And today, we're going to trace every cent of it. Just days ago, the SSA verified what they termed the top-tier payment calculation for eligible retirees, covering disbursement timetables that hadn't been revised in more than a year. These are the sorts of changes the administration only enacts when they are communicating something very deliberate: inflation acknowledgement, healthcare expense integration, or payment redesign. Economic observers weren't sure which box this fit into, or if it touched all three simultaneously. But what was evident was that Social Security was altering its payment stance, and when federal entities modify payout frameworks without detailed clarification, even by tiny margins, every retired person takes notice. The confirmed number of $247 stands as the projected gross monthly Social Security payment for many born prior to 1960. This sum mirrors the highest potential disbursement for those who earned at or beyond the contribution cap across their working lives and filed at the perfect moment. But here's what the news stories omit. That full $247 almost never actually lands in most people's accounts whole. The second your Social Security amount is determined, Medicare Part B intervenes with its compulsory monthly charge. And for next year, that charge is set at $185 each month for basic participants. But for people reporting larger earnings, that number can surge to $398 or more, dictated by income-based monthly adjustments called IRMAA. The communication released by the SSA was not ordinary. It was not procedural. It was not for show. It was instructional in a manner that commands your focus. Financial planners, after examining the details, labeled the scenario as foreseen yet aggravating, required yet disheartening, and critically, an issue needing swift strategic changes. But comprehension only matters if the retiree acts. Millions do not. In reality, their reaction at this moment stands as one of the most inactive we've observed in retirement finance. Here are the facts. Within a short window of the benefit confirmation, Medicare Part B takes its premium automatically. These weren't elective withholdings. These were obligatory removals, fees that the federal system only imposes when it is guaranteeing medical coverage stays current. For an individual getting the $2.47 maximum, if their earnings from 2 years prior place them in an elevated tier, they might find $398 subtracted before they receive anything. That results in $2,249, and that's prior to any local taxes, prescription drug plan costs, or additional insurance payments. This week, the SSA affirmed that retirees collecting maximum benefits fit into distinct groups, including those who filed at 70, who had been delaying for what experts call ideal benefit growth. Medicare Part B withdrew funds before Social Security could transmit to accounts. They impacted top earners. They impacted middle-class retirees. They impacted those with pension payments that elevated their tier. Stated plainly, Medicare accessed the benefit before it could become usable cash. The premium that might have been voluntary years ago is now inevitable. This is what rendered the warnings from finance professionals so pressing. Social Security's payment boost wasn't merely notional, it was operational. It symbolized the sort of funds that could alter retirement if not met with automatic subtractions. And Medicare, recognizing that completely, answered with compulsory premiums, not unlawfully, not surprisingly, but methodically. They didn't bypass high earners. They didn't excuse anyone over earning limits. They impacted every tier with accuracy. They applied every income-linked modification. Let me outline the IRMAA tiers for you. For single filers with an adjusted income under $103,000 or joint filers under $206,000, the standard Part B premium of about $185 per month is in effect. But for singles earning between $103,000 and $129,000, that premium escalates. For those between $129,000 and $161,000, it climbs once more. For the bracket between $161,000 and $193,000, you're seeing premiums near $400 monthly. And for incomes surpassing $500,000, premiums can top $600 each month. The $398 figure we mentioned represents seniors in that upper middle income range. People who saved diligently, invested prudently, and now discover themselves financially penalized for their prudence. And here is where the narrative grows more alarming. Economic analysts now suspect Medicare's newest premium framework was engineered to probe the limit of what retirees would tolerate after a series of steady hikes. Officials wished to observe if seniors would challenge automatic withdrawals, but instead, the reverse occurred. Retirees didn't dispute the mechanism. They accepted deductions so automatic, so unseen that even their relatives didn't spot them. You don't easily capture the government's focus. But today, advocacy organizations succeeded. Retirement policy specialists, speaking to major finance outlets under condition of anonymity, depicted Medicare's pricing model as medical cost transfer, a method to move rising treatment expenses onto recipients through premium hikes linked to inflation. Yet the SSA demonstrated today that they are both liberal with gross payments and limited with net amounts. Their math was not just correct. It was tuned so exactly that the brackets ensnared almost every retiree with substantial earnings. That specificity is important because it reveals the program is functioning precisely as intended. It reveals that Social Security is not your final deposit. It is your commencement point before subtractions start. As updates flowed in this week, we grasped the magnitude of Medicare's automatic actions. Standard participants saw $185 removed, keeping large parts of their payment whole. Higher earners saw $300 to $400 deducted based on income from 2 years ago, income that might not match their present financial picture. Married couples filing together encountered compounded formulas rooted in joint earnings, creating scenarios where both partners faced higher premiums. This wasn't merely fee gathering. This wasn't merely healthcare financing. This was systematic benefit diminishment. This was retirement income re-engineering. And re-engineering is the single factor retirees have found hardest to prepare for since these rules were enacted. For every payment increase they've gotten, Medicare has answered with something that lessens the effect. This year, the inflation adjustment was meant to help seniors match rising prices. But when Medicare premiums grow quicker than the COLA, seniors end up losing ground despite receiving a larger gross sum. Recall, seniors born before 1960 believed retirement would be straightforward. They believed Social Security would be their stable base. They believed Medicare would be economical health protection. But tonight, the exact inverse is occurring. Social Security benefits are sizable on paper, but diminished in reality. Medicare expenses are swelling faster than payment boosts. Retirement stability is becoming more intricate, not simpler. The generation that constructed this nation is now steering through a system that recaptures major chunks of what they've accrued. And for those born between 1943 and 1959, you're trapped in a shift where full retirement ages, benefit formulas, and Medicare premiums all merge in complicated fashion. What renders this instant so pivotal and so immediate is that the SSA's latest verification occurred when retirees face exceptional monetary strain. Housing proponents seek affordable senior residences. Medical institutions seek viable Medicare financing. Taxpayer alliances seek budget prudence. Retiree coalitions seek payment safeguards. The government is juggling these demands while overseeing a Social Security trust, confronting long-term viability queries. And when systems in that posture make framework changes, they aren't acting from surplus. They're acting from need. They're acting from demographic strain. The worker-to-retiree ratio keeps contracting. The beneficiary count keeps expanding. And the arithmetic keeps getting tougher. The SSA's benefit confirmation, now available publicly, was crafted to indicate that officials aren't ready to discard their pledge to retirees. Authorities stated clearly that Medicare's premium setup complied with legal mandates. That is bureaucratic talk for, this is the law in operation and we are executing it precisely. You don't typically hear that tenor from government bodies unless something major is on the line. The suggestion is obvious. These deductions are lawful, required, and permanent. If anything, they're apt to rise in coming years as medical costs continue ascending. Concurrently, the Social Security Commissioner spoke to recipients in a straightforward informational release this month. They stated benefits are computed to mirror your lifetime wages and your filing age. They stated Medicare premiums are established by statute and modified yearly. And they stated we urge all recipients to examine their Social Security summaries closely. These aren't comforts. These are declarations from an agency that knows precisely how high the stakes are now. Here's what makes the landscape even more worrisome. Medicare Part B's premium wasn't alone. Alongside the main premium rise, Medicare Part D premiums also shifted, impacting medication coverage. Medigap plan costs rose based on insurer decisions. State-level taxes in certain areas continued applying to Social Security income. All this transpired within the same annual cycle. When numerous deductions synchronize, it signifies a broader force is influencing retirement earnings. Financial guides are now evaluating several paths for their clients. One is that retirees should brace for ongoing premium climbs through meticulous income strategy. Another is that retirees should try to control their modified income to remain under IRMAA ceilings. A third path, the one troubling advisors most, is that retirees might need to rethink their entire retirement income approach to lessen Medicare premium impact. But today, knowledgeable retirees treated that concern gravely. They didn't disregard their statements. They didn't accept deductions without analysis. They didn't presume next year would improve. They planned tactically. What we're witnessing now is a trial of retirement comprehension. The government wants to see how retirees react to complex payment frameworks. Financial advisors want to demonstrate to clients how to maximize within regulations. Advocacy groups want to stop benefit decay, and retirees want to prevent retirement uncertainty. Tonight, we've listened to financial strategists who are now amending client plans. They mention Roth conversions before retiring can help manage future exposure. They mention qualified charitable distributions can lower taxable income while aiding charities you support. And they mention the government's choice to auto-deduct Medicare premiums is probably part of a wider funding plan meant to preserve program viability. But retirees are not powerless. In fact, retirees are growing more educated. Their response today, researching, questioning, and strategizing, sent a signal to financial firms that knowledge counts. And it sent a signal to officials that openness is required. As the benefit period continues, we anticipate more specifics to surface about what this payment framework truly means for each retiree. But what we understand is that grasping your benefits was timely. It readies you for practical retirement budgeting. It enables income optimization tactics, and it equips you to make informed choices. What occurs next will hinge on what you execute in the coming quarters. If you strategize meticulously, this moment will be recalled as the alert you required. If you dismiss these truths, the system has already demonstrated its operation. You hold the power to respond. You possess the capacity to plan. And tonight, for the first time in years, retirees seem to be focusing. Washington is computing, always computing. And when the government computes, it means they are forecasting expenses carefully. It means they are devising their next modification. Because tonight, retirees discovered something they might have previously missed. Your gross benefit is not your take-home pay. Medicare Part B subtracts automatically, and the sole defense is awareness. This story is not concluded. But tonight, one reality is evident. The $2.47 benefit is authentic. The $398 Medicare withdrawal is authentic. And your net retirement income hinges completely on your attention. And we will continue clarifying every facet as the next chapter develops. If this breakdown brought you value, showing your support with a like truly helps our channel, my channel, continue this work. Your awareness is your most powerful tool.